And our next speaker is Cheneal Puljević. And so I invite you to come up to the podium. Okay. So Cheneal is a Senior Research Fellow at the Centre of Research Excellence on Achieving the Tobacco Endgame. She's funded by an ARC DECRA Fellowship, and her current research focus is on the drivers and deterrents of illicit tobacco use. Cheneal is also a core research team member for the Global Drug Survey, an associate editor for the International Journal of Drug Policy, and the Queensland Research Lead for the Loop Australia. Thank you.
Well, good afternoon, everybody. Thank you for coming along. My name is Cheneal Puljević, and today I'm going to be speaking, well, continuing the theme of perceptions of tobacco endgame policies, this time among respondents of the 2024 Global Drug Survey. I'd like to thank all my co-authors, in particular Alice Holland, who did all the data analysis and created the graphs that you will see today. As Coral said, I'm funded by the Australian Research Council, and I have no conflicts of interest to declare. I too would like to acknowledge the traditional owners of the unceded lands that we meet on today, the Turrbal and Yagara people, and pay my respects to elders past and present. So I certainly don't need to explain what tobacco in-game policies are to this audience. We all know that these are policies that aim to permanently and rapidly reduce smoking prevalence to minimal levels by a specified date. And here are some examples of countries with endgame goals with various dates by which they aim to reach less than 5% prevalence. A few years ago, we completed a scoping review of tobacco in-game evidence syntheses. And as part of that process, we compiled this list of policies that were generally considered to be endgame policies if fully implemented based on the expert opinion of the authorship team. Apologies for the wall of text. These are divided into product-focused, user-focused, market or supply-focused, and institutional structure-focused. And here are the three that we're most familiar with. Of course, the three that were meant to be implemented in New Zealand. So that's mandating a very low nicotine content, restricting tobacco sales by years born, and restrictions on tobacco retailer number, density, or location. And we know that England are in the process of attempting to implement the tobacco-free generation policy as well. To date, we have fairly strong evidence base for the public health benefits of these policies, but there are still concerns among policymakers and stakeholders about the feasibility of some of the proposed policies because their political acceptability is uncertain, and most of these policies have not been implemented or have only been implemented on a local level. As such, widespread understanding and support among the public for the endgame concept and associated policies would enhance their feasibility. Furthermore, understanding the support for these policies among population subgroups can assist with implementing targeted education campaigns to overcome common misperceptions and therefore increase policy support. Last year, a few of us were involved in a systematic review and meta-analysis of studies assessing public support for tobacco in-game policies led by Hannah Kim and Hyewon Kang. But a preprint is available, it's still under review, but a preprint is available online. Three-level meta-analyses showed the highest support for mandating a very low nicotine content in tobacco products and found that overall support for in-name policies was lower among people who smoke compared to the general population. This review also identified that no studies have assessed support for these policies among people who use drugs. Considering high levels of tobacco use typically reported among people who use drugs, including alcohol, this seemed like a research gap worth exploring. Here are our three research questions for the study. We want to know how levels of support differ for various policies among a sample of people who use drugs. And we're also curious about whether levels of support differ based on which drugs people use and if they vary by country. The survey only closed about a month ago, so we're still doing data cleaning, and of course I have limited time today. So I'll only be providing the results for the first question, but we will show the results for the international sample versus the Australian sample. The data source for the study is the Global Drug Survey, which is the world's largest study of drug use. And for those who attended my rapid fire presentation yesterday, the slide will look very familiar. It has been running annually since 2013 and typically recruits very large samples of over 100,000 people across the world each year. Unfortunately, we did not reach anywhere near that this year for a number of reasons, but I'm still pretty happy with the sample size overall. To take part, respondents must be aged at least 16 years old and have used at least one substance in the past year, including alcohol or tobacco. Participants are recruited via adverts for the survey that are distributed on social media, via articles in the media promoting the survey, and a lot of emails from me begging people to take part. As such, this is a cross-sectional convenience sample with an overrepresentation of people who use illicit drugs. The 2024 survey was open from January until the end of April this year. So other than yesterday's audience, you are the first people in the world to see any of the results from this survey. We included a module that measured people's support for 10 endgame policies, and these were shown to all respondents, not just people who indicated tobacco use. We had just over 8,000 people complete this module. They had a median age of about 33 years old. Most respondents were male, and in terms of the countries of origin, the 7 most common countries were Spain, Germany, USA, Australia at just at 9% of the sample, France, Mexico, and the UK. Here is the breakdown of drug use among the sample. So you can see that almost everyone had used alcohol in the past year. There are high levels of tobacco and e-cigarette use, rather high levels of cannabis use at 70%, and then also quite high levels of all the other use of all the other drugs compared to the general population. So for each variable, we've shown the results for the Australian sample in orange and the overall international sample in blue. Here we can see quite high levels of support for greatly reducing the amount of nicotine in cigarettes, with around 40% of the overall sample saying they strongly support this policy. And we can see high levels of support among the Australian respondents compared to the international sample. In terms of reducing the number of tobacco retailers to around 5% of the current number, in the international sample, we can see that the most common response was don't know, whereas among the Australians, this was strongly support. Then respondents were asked to what extent they support or oppose their government completely banning the sale of tobacco in their country within 10 years. I find this one interesting. The overall international support were most likely to report opposing or strongly opposing this policy, while the Australians were most likely to report strongly supporting this one. The next question was about support for making cigarette companies pay for the costs of treating tobacco-related diseases, funding cessation programs, and addressing the environmental impacts of tobacco product waste. And here I'm happy to see high levels of support for this policy among the international and the Australian sample. Then in terms of increasing the tax on tobacco by 20% a year, we see mixed levels of support among the international sample. The opposed option was the most common response, but the strongly support bar is not far behind. And then again, amongst the Australian sample, we see that respondents most commonly selected strongly support, which I'm a bit surprised by after all the media that we've had in the last few days. But we do also see fairly mixed responses for this one. Next is support for a tobacco-free generation, banning tobacco sales to everyone born after a certain year. And here again, we see fairly mixed results for both samples, but they were most likely to report opposing the policy, while again, the Australians were most likely to report strongly supporting the policy. The next question assessed support for banning filters on combustible tobacco products. This question also had this text box before it to provide information to respondents that, contrary to popular belief, cigarette filters do not reduce the harms associated with smoking. Instead, they may increase harm by enabling people to inhale smoke more deeply into their lungs, and they are a major source of plastic pollution. Interestingly, both samples were most likely to report don't know. And I wonder to what extent this is because many people believe that filters reduce the harms associated with smoking, but then we're telling them the opposite, hence their confusion. But again, the Australians were more likely to support this sample than the overall international sample. Then finally, we asked about support for allowing access to nicotine vaping products as a harm reduction option. We also included extra text for this one before the question. Evidence suggests that nicotine-containing e-cigarettes are not risk-free, but expose people to far fewer harmful chemicals than tobacco smoke. Both samples were most likely to support or strongly support this policy, and surprisingly, there are high levels of support among the Australians, despite what the Australian media wants people to believe. So to wrap up, in terms of which policies are the highest level of support, making the tobacco industry cover costs had the highest level of support, with over 80% of the sample supporting it, followed by mandating very low nicotine content, with about 66% of the sample saying support or strongly support for that one. And that reflects the findings of the systematic review that I mentioned earlier. In terms of the policies with the lowest levels of support, just over half of the sample opposed banning tobacco sales, followed by about 44% of the sample opposing the tobacco-free generation policy, which is interesting and contradicts some of the other studies. So it seems that perhaps people are least likely to support the most extreme policies in terms of limiting people's access to tobacco. What I really want to know is, why are there such high levels of support among Australians for all of these policies compared to the international sample? To be honest, I don't know. I will do more analyses comparing the samples in terms of education and employment to see if maybe there's something there. There are also questions on support for decriminalising illegal drugs. So I want to see those results to see if there's any differences. Of course, this is also a non-representative sample that limits our ability to meaningfully compare the samples. But there is also one other potential reason for this finding. We have the most incredible network of researchers across Australia and other countries who are working very hard every day to produce high quality research that builds the evidence base in this area. So maybe people are actually reading our research and starting to understand the merit of these initiatives. Who knows? Thank you very much.
Ron's got his hand up.
Just a speculation of why the Australians might be more supportive. You may have a lower percentage of smokers in the Australian sample because population prevalence of smoking in Australia is relatively low compared with several of the other countries you had as your main sources of supply. So I think it'll be important to look as a function of actual tobacco use and perhaps vaping use too.
Yes, no, definitely.
Experience of vaping might be more likely to support some of the policies.
Yeah, no, definitely we'll look at that.
Got a question at the back there? Oh.
Thanks for the presentation. Just following on from Ron's comment, could it be also because in Australia we're fairly used to being heavily regulated on a lot of different fronts, so they might have some more sort of like, might be a higher level of pre-existing sort of support for more extreme measures relative to some other countries?
Could be.
True.
Kind of more of your findings come out. I just wanted to ask, kind of, you said you'll mention you'll look at the associations in particular drug using groups, and I wondered, is cannabis users a group of interest, and what is your specific exposure for cannabis use? So I'm generally interested in co-administration, so this population that also makes a cannabis with tobacco. So what is the measure of cannabis use? Is it just kind of any use? Co-administration specifically, concurrent use? Yeah.
Great question. Yeah, definitely we'll be looking at differences in support according to which drugs people use. And for cannabis, it's just, have you used it in the past year, yes or no? So yeah, that's worth looking at frequency of use as well. And we actually have a study using global drug survey data from a few years ago, looking at co-administration of tobacco and cannabis, and who are the people doing that and why are they doing it and what can we do to stop them. So we should chat about that. Great.
There was another question down here.
Thanks, Cheneal. I was wondering whether you have done a kind of cross-validation of your sample and the level of support for the different policies against other surveys like the National Drug Strategy Household Survey, which is more representative of the total Australian population?
Unfortunately, they haven't asked about these things.
All policy support questions that could maybe be looked at, including tobacco
Endgame, but they
general support for various policies. Yeah.
different tobacco
tax
policies.
in that one. They might have tax increases in that. Yeah,
Yeah, they do.
Yeah, great idea. We'll have a look at that. Yeah.
And have you done that in the past of contrasting your sample to the distribution of drug users in the NDSHS?
Not for this study yet. We have done it once before for methamphetamine use, and we found quite similar results. paper didn't end up being published, but yeah, we were able to say that there was some kind of convergence between the two. Yeah. Great.
Any other questions for Cheneal? No? Okay. Let's thank Cheneal and welcome to the stage our next speaker. So thanks, Cheneal.